Hello dear friends, have a good day. This is our another video regarding Fundamentals of Nursing, questions and answers. If you are not subscribed to this channel, please hit the subscribe button right below. Question starts here. First question. A client who is obese is at risk for poor wound healing postoperatively because risk for bleeding is increased, ventilatory capacity is reduced, fatty tissue has a poor blood supply, resuming normal physical activity is delayed. Correct answer is fatty tissue has a poor blood supply. The poor blood supply in fatty tissue structures slows the delivery of essential nutrients, antibodies and enzymes needed for wound healing. Next question. A client who smokes 2 packs of cigarettes per day is most risk at postoperatively for Atelectasis, fever and pneumonia, hypertension, cardiac dysarrhythmias and fever, hypertension, confusion and elevated glucose level, urinary infection, fever and malignant hypothermia. Correct answer is Atelectasis, fever and pneumonia. The chronic smoker already has an increased amount and thickness of mucus secretions in the lungs. After surgery, the client who smokes has greater difficulty in clearing the airway of mucus secretions. Next question. Maintaining normal glucose levels in the postoperative period reduces which complication? Ileus, bleeding, wound infection, deep vein thrombosis. Correct answer is wound infection. Hyperglycemia increases susceptibility to infection and impairs wound healing. Next question. In the post-anesthetic care unit, the nurse notes that the client is having difficulty breathing because of an obstruction. The nurse would first suction the pharynx and bronchial tree, give oxygen through face mask at 10 liters per minute, ask the client to use an incentive spirometer, position the client so that the tongue falls forward. Correct answer is position the client so that the tongue falls forward. In the post-anesthetic client, the tongue causes the majority of airway obstructions, so the client should remain side-lying position until airway are clear. Next question. A client with prothrombin time or an activated partial thromboplastin time greater than normal is at risk postoperatively for infection, bleeding, low urine output, cardiac dysarrhythmias. Correct answer is bleeding. Next question. When the client is deep breathing and coughing, it is important to have the client sit because this position is more comfortable, facilitates expansion of the thorax, helps the clients to sprint with the pillow, increases the client's view of the room and is more relaxing. Correct answer is facilitates expansion of the thorax. Next question. The ambulatory surgery centers are also known as all of the following terms except inpatient surgery centers, outpatient surgery centers, short stay surgery centers, same day surgery centers. Correct answer is inpatient surgery centers. Next question. Which type of surgical procedure is performed to improve personal appearance? Major surgery, minor surgery, ablative surgery, cosmetic surgery. Correct answer is cosmetic surgery. Next question. Which type of surgery must be done immediately to save life or preserve body function? Cosmetic surgery, palliative surgery, elective surgery, emergency surgery. Correct answer is emergency surgery. Next question. Repair of cleft is considered under which classification of surgical procedure? Minor, constructive, diagnostic, palliative. Correct answer is constructive surgery. Here the difference of constructive and reconstructive surgery. Constructive surgery means it's a restoration of function lost or reduced as a result of congenital abnormalities. And reconstructive surgery means it's a restoration of functions or appearance to traumatized or malfunctioning tissues. Next question. Which of the previous medical condition of the client may alter metabolism and elimination of drugs administered during surgery and impairs wound healing and clotting time? Fever, upper respiratory tract infection, liver disease, diabetes mellitus. Correct answer is liver disease. Next question. The prolonged use of which among the medicines may cause adrenal atrophy that reduces the body's ability to withstand stress during surgery? Antibiotics, anticonvulsants, diuretics, corticosteroids. Correct answer is corticosteroids. Next question. Which of the following condition potentially happen because of the history of using herbal therapy like ginger? Bleeding, hypoglycemia, impaired circulation, electrolyte imbalance. Correct answer is bleeding. Next question. Cuffing exercise often contraindicated immediately after following surgeries except hysterectomy, brain surgery, spinal surgery, eye surgery. Correct answer is hysterectomy. Next question. Application of warm compress is indicated to reduce pus for a client who is shivering, to improve blood flow to an injured part, to protect bony prominence from pressure ulcers. Correct answer is to improve blood flow to an injured part. Next question. A binder placed around a surgical client with a new abdominal wound is indicated for collection of wound drainage, reduction of abdominal swellings, reduction of stress on the abdominal incision, stimulation of peristalsis. Correct answer is reduction of stress on the abdominal incision. Next question. Serous drainage from a wound is defined as fresh bleeding, thick and yellow, clear watery plasma, beige to brown and foul smelling. Correct answer is clear watery plasma. Next question. The clients with the following medical conditions are contraindicated for warm, moist compression to an open wound except asthma, diabetes mellitus, stroke, peripheral neuropathy. Correct answer is asthma. Clients with diabetes mellitus, victims of stroke, and clients with peripheral neuropathy or who have very thin or damaged skin are at risk of thermal injury. Next question. Which of the following statement is incorrect when applying an elastic bandage? Apply bandage to lower extremities before client sits or stands. Cover toes or fingertip with bandage. Elevate the dependent extremity for 20 minutes before bandage application. While applying bandage, roll the distal part of the extremity first. Correct answer. Cover toes and fingertip with bandage. Toes and fingertips needs to be visible for follow-up circulatory assessment. Early detection of circulatory impairment ensures healthy neurovascular status. Next question. The benefits of applying bandages and binders includes the following except reducing or preventing edema, securing a splint, creating a pressure over a body part, replacing the wound dressing. Correct answer is replacing the wound dressing. The bandages and binders only give the support to underlying dressing. They cannot replace the dressing. Next question. Which of the following laboratory values would you expect in a client experiencing prolonged immobility? Calcium 11.5, sodium 142, hemoglobin 14.6, potassium 4.2. Correct answer is calcium 11.5 mg per deciliter. Immobilization results in bone resorption. The bone tissue is less dense or it is atrophied and diffuse osteoporosis results. Next question. The client at greatest risk for developing adverse effects of immobility is 3-year-old child with fractured femur, 78-year-old man in traction for a broken hip, 48-year-old woman following a thyroidectomy, 38-year-old woman undergoing a hysterectomy. Correct answer is 78-year-old man in traction for a broken hip. In older adults, the bone healing will be delayed due to degenerative conditions, so he is at risk for immobility. Next question. What is the use of applying elastic stockings on a client following major abdominal surgery? It prevents varicose vein, prevent muscular atrophy, ensures joint mobility and prevent contractures, facilitate the return of venous blood flow to the heart. Correct answer is facilitate the return of venous blood to the heart. Next question. The nurse is caring for a client with a right-sided weakness. What should the nurse do while working with the patient? Hold the client's left hand while working. Hold the client's right hand while working. Put a guide belt on the client and support on the left side. Put a guide belt on the client and support on the right side. Correct answer is put a guide belt on the client and support on the right side because patient has right side weakness. Next question. During the enema, the client begins to complain of pain. The nurse notes blood in the return fluid and rectal bleeding. The nurse's action is to stop the instillation, slow down the rate of instillation, tell the clients to breathe slowly and relax, stop the instillation and obtain vital signs. Correct answer is stop the instillation and obtain vital signs. Next question. The client with the pre-op medical history regarding abuse of street drugs should be screened for hypertension, depression, HIV and hepatitis, upper respiratory infection. Correct answer is HIV and hepatitis. Next question. The patient with moderate to severe pain usually shows the following symptoms except diaphoresis, fever, tachycardia, elevated blood pressure. Correct answer is fever. The questions ends here. Thank you for watching this video and please subscribe our YouTube channel and like our Facebook page, The Nurse. Thank you.